Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, the growing role of social media in organ transplantation, from finding community and sharing transplant journeys to helping patients search for living donors online. Stephanie Desmon is joined by Macey Levan, a transplant researcher whose work examines how social media is reshaping the transplant experience and raising new questions about equity, ethics, visibility, and connection in healthcare. A special thank you to our listener, Kelly, for the idea. Let's listen.
Macey Levan, thanks so much for joining me.
Thank you so much for having me, Stephanie. I'm honored to be here today.
Today, I wanted to discuss the growing role that social media plays in medicine, and particularly in organ transplant cases. I know that social media has sort of become a place to share updates with family and friends, but what are people really using this for?
So we've done a lot of research on social media and organ donation and transplantation over the years. And the thread that continues is people are using it to share their stories, share their need to get transplanted, as well as trying to connect with other communities and understand how things are in other parts of the country or the world for that matter. So I see a lot of transplant hospitals and organ procurement organizations utilizing social media to connect with the communities they serve and to meet people where they are.
I have a dear friend who's looking for a kidney as we speak. I actually helped him write a letter he put on social media for his friends and family to see. It was interesting the line we tried to walk, between saying, I really need your kidney or learn more about transplantation. And I'm curious sort of what are kind of the elements that you see.
We've done a lot of research on this over the years. And the key message that I think I would share with everyone is the more you spread your message to your community, and social media is an extension of your community, right? Of the larger social network that you have, the better off that you are in understanding people's willingness not only to step forward, but even if someone isn't willing to step forward to be your living donor, maybe they're willing to step forward and talk about donation. Maybe they're willing to step forward and talk about deceased donation. Maybe they're willing to talk to another community member about this. So it's really about awareness and advocacy. And it's really hard when you're that person that needs a transplant to do that work. We've done a lot of work. We created a program over the years called the Live Donor Champion Program that now has kind of been combined with another program called Live Donor Navigator. And it's for these transplant recipients or hopeful transplant recipients, people with kidney disease. They're tired. They're usually on dialysis. Separating the patient from the advocacy role is really important. And that's sort of where this work has been born from is that burden on the patient is a lot. And so if you can create other people who can be a champion or who can communicate about this with them, that's important. In my own life, I received a message when I was in my first year of law school. This was back in 2008 from my aunt, an email that said, your cousin is on dialysis and needs a kidney transplant. Is anyone interested in donating? So back before we even defined what a live donor champion was, I received one of those messages. And immediately I said, yes, of course, I'll get tested. And I did end up getting tested and I was his perfect match. And I ended up being his kidney donor. And that was 17 years ago. But he didn't ask me. His mother asked me. And so when we separate the patient from that advocacy role, I think it does empower us all to have better and easier conversations just because of the burden of that ask. It's difficult for people.
Now that I know this, I need to ask more. I guess this is why you got into this kind of work.
It absolutely is. So I was in my first year of law school in Bloomington, Indiana, and I received the message. I ended up getting tested. I was his perfect match. We ended up having a kidney transplant the following summer. And after that, I started to ask a lot of questions about kidney donation that maybe I couldn't have received answers to at that time. So there was a lot of things. What are going to happen to you when you're 60? Will you need a kidney? What is the safety of all this? And so the science of living kidney donation has really evolved since I became a donor 17 years ago. And a lot of that work is the people that I currently work with today, like Dr. Segev and Dr. Montgomery. And we've really made sure that kidney donation from a surgical perspective is very safe. It's very rare that people have a complication from the actual procedure. And in the long term, we are doing our best to provide the best care to donors afterwards. That's really been the focus of my career. I went to do my PhD in health policy and management from Indiana University School of Public Health. And I started to learn about how do we get data and how do we follow these donors? How do we take care of them afterwards? How do we make sure that they don't end up themselves one day needing a kidney transplant? And so yes, my personal experience kind of catapulted me into this trajectory of how do we make our transplant system particularly better in the case of living donation. Since then, I've done a lot of additional work in our national transplant system and gotten really big into the advocacy space. I was elected a few years ago as the Vice President of Patient Donor Affairs for our national transplant system. And in that role, I really started working with donor families a lot more and some other pieces of the puzzle. But really, my passion started because it's something I did myself, and I wanted to make sure that other families and other people had the opportunities that not only we did, but that it got better for everyone.
Making your story really visible on social media, telling your story, it can literally change who gets access to an organ. So, how does social media become part of the transplant ecosystem in the first place? And then, how do we deal with those kind of equity issues?
Originally, there were people that didn't think we should do this. Okay. It took a lot of time, I think, for the national community to get comfortable with the idea that social media was an extension of what some folks were already doing by putting a billboard up on the side of the road or a bumper sticker on the car. Call me because I need Joe needs a kidney, right? But really now, I think we have seen social media evolve as a day-to-day part of how we communicate, not only with people that are close to us, but people that we don't even know. And so it's been this extension of the social network. And I'll give you a recent example of something that I think is important. So there was a former New York Jets football player who ended up needing a kidney transplant. And he went to People magazine and he told his story and his need for a kidney. Hundreds of people ended up calling the transplant center. Unfortunately, he ended up dying before he was able to get that kidney transplant. But there's hundreds of other people who were interested in learning more about donation or who were interested in kind of being able to maybe support through being a donor themselves. And it's the message that we get across by talking about it that might inspire those people just because they couldn't give to this football player. Maybe they can give to the list. Maybe they can be a non-directed donor to someone else. And so I think that social media is inherently important in every patient that walks into our doors in every transplant center. Every transplant center should have the capacity and the resources to teach every patient how to communicate as broadly as they can with their social network. Not everybody wants to, but everyone should have the ability to have access to that. And I think that starts at our transplant centers.
It seems like I have a broader network than someone else, then I might be more likely to get a kidney. And that feels like that crosses some ethical lines, perhaps.
It can, but everybody should have the same, right? So I was actually, NBC News reached out to me to ask me specifically that question. They're like, is it unethical that he's asking People magazine, and this is ending up on nightly news on NBC? And I was like, well, no, because just because he has a bigger social network doesn't mean he shouldn't use his big social network. I do believe everyone should use every social network they have access to, even if their Facebook friend group is 100 people or 100,000 people. We should be able to utilize that. But again, the equity comes in making sure that every transplant candidate that comes through the door has access to knowing this, and that starts at the transplant center. A lot of that comes through funding. A lot of these roles need to be professionalized in transplant centers. People are busy, right? So you have transplant coordinators who are busy managing all the logistics of donor evaluation and all the calls that come in. So it really needs to be something that we talk about and normalize, because everyone deserves the same level of access. Even if their community is 100 people, they should be able to tell 100 people, not just 5 or not just 10.
For a transplant patient thinking about using social media to find a donor or build community, what do clinicians and researchers wish they understood beforehand?
I think it's really important to understand what information you put out there, because if you're putting something out there, it's public, right? So ensuring that You're not putting all of your protected health information online in some of these situations. There's some really structured guidance for how to do that. And a lot of that has been documented. There's resources for that. And transplant centers should be able to provide those patients with resources about how to do it. But we really start with asking them to tell their story about living with kidney disease. And so, what does it mean to actually live with kidney disease? What does it mean to need to make that ask to get a transplant? That's a difficult thing. And then we usually like to connect these people with a transplant center that can educate them appropriately on risks and benefits of living donation. That's not necessarily something that all recipients should feel or candidates feel that they need to be able to do in these kind of social appeals, if you will. They really need to talk about themselves and how this impacts their life. That's really my best advice, is to tell their story. Tell us why, when, and how this happened, and make sure that the people understand the best resource to connect with is that transplant center. There's also several nonprofits that are around. There's the National Kidney Registry that provides a lot of information on non-directed donors and kidney paired exchange programs. But I'm partial to saying contact the transplant center for which the patient is listed, and they will be able to onboard you as quick as possible and to get you the right information, as well as easily rule you out if you're not able to donate for some medical reasons. They'll be able to show you, maybe how else you can help. Even if you're not able to be a donor yourself, you can be a champion for the cause and talk about donation. It's almost every day somebody will say something about, oh, I didn't know you could live with one kidney. And, I'm like, I'm here to say I've lived with one for 17 years. It's very possible. And I think about 6,000 to 7,000 people a year make that decision. And there's over 160,000 living kidney donors today in the United States. The NIH has funded more than $150 million of research into understanding our outcomes and other pieces to that puzzle. And we're still learning more every day. So kidney donation is not as rare as you might think. And I think just by talking about it and bringing it to the forefront of people's mind is very important. There's a lot of celebrities now that are coming forward and talking about their kidney donation story. We had back in the day, it was Selena Gomez, and she received a kidney transplant from one of her friends. And so she had elevated the cause. Most recently, Jesse Eisenberg donated a kidney actually at my transplant center and is talking out about kidney donation. So it's really awareness that it's possible, and that can save a life.
Putting it out there, these journeys unfold publicly on TikTok or Instagram in real time. That really does change the way that people perceive the information, that people are brought into the cause.
It really does. People are touched and moved by real stories about real people. And I would suggest that people that need to find a kidney donor talk about their tribulations, their things that they want to do, because dialysis is difficult and it makes you tired. It kind of tethers you to a location. Sometimes people can't travel like they might want to be able to travel. So thinking about the way life could be like if you received a transplant is really an interesting way to appeal to others to understand the burden of kidney disease and the burden of treatment of dialysis. Dialysis is life-saving for many people. It keeps a lot of people alive, and there's nothing wrong with dialysis. But we do know in transplantation that live donor kidney transplantation and a kidney transplant is the best treatment option for end-stage kidney failure.
Do you think that, all the social media attention, do you think it's changing transplantation itself? How people experience illness and hope even?
I would say so. I think I see a lot of online communities that are created for transplant patients. They provide a level of camaraderie that you wouldn't find elsewhere, even if you had a transplant center support group, maybe for, let's say, in Baltimore, right? That's people just in one community. I've seen larger social media communities that have people from all across the country. They also come into play with connecting with these donor families that make deceased donation possible and say yes in their worst moments of life. And that helps share hope because they see this happen to somebody else. I'm not just sitting in my dialysis chair and the next day I'm in my dialysis chair and the person next to me isn't there because they died. Instead, they're reading, this person got a live donor transplant, or this person connected with their donor family online. And sharing those stories, I think, really does show and give hope to people. In fact, I'm certain of it. I've seen it myself.
What do more people need to know about this?
I think the answer to that is incredibly simple. People need to know that living kidney donation is the best treatment option for end-stage kidney failure. While you may hear us talking about all these new advancements in technology, you may hear the word xenotransplantation and pig kidneys, and yes, we're working on that. We are still at a point where we're dependent on our deceased donor allocation system, and donation is actually down in this country. In this past year, we've had the largest year-on-year decrease in deceased donation ever. And so living donation is still an incredibly important area of growth and necessity to help people that need a transplant now get it. And for me, I would say it's important to know that people can live a healthy life with one kidney. I'm here living proof to say that it's possible. And I think that's really the number one message, is that it is possible to do. You can live a great life with one kidney, and you can help someone maybe that you love, or in some circumstances, maybe someone that you don't.
Macey Levan, thanks so much for joining me.
Thank you so much for having me, Stephanie. I appreciate your time.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.